we're going to do his biceps. Okay, we're just getting started on the right shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. We'll show you right out of the gate here your biceps. You can see it's kind of red and irritated, and it's torn down here. So this is what a slap lesion or a degenerative slap lesion looks like. You can see how that's loose. So in just a minute, we're going to pass the spinal needle through it with a shuttle relay and a suture. You've got a partial tear in the rotator cuff here. So we'll pass a stitch across that also, just kind of as a marker stitch, so we can make sure that the cuff is okay on the other side. But the main thing right now is the biceps. We're just confirming what we expected to find here. Okay, so this is where we're at. We've got the biceps secured and cut, as you can see. We're going to smooth out the labrum a little bit more, but now that the biceps isn't attached, that shouldn't be unstable anymore. And then we've got a marker stitch, kind of a ripstop marker stitch going across the cuff right here. Okay, and so we're going to go off on the video. Next thing we'll show you will probably be up in the subacromial space in just a minute. All right, so we're looking at the rotator cuff. We've already taken off a pretty good sized spur off the acromion. And these are our sutures for the cuff. And the good news is the cuff, you can let go of those. The cuff looks good. This is the posterior part of the cuff as I internally rotate. There's our sutures that are marking the area that's partially torn. And this is the anterior portion of the cuff as I externally rotate. So, so that looks good. We're going to go ahead and tie that now. Okay, so we're all done here. We're just going to get you back to the recovery room. I just want to show you what we've done up in the subacromial space. There's our ripstop stitch for the cuff, and our biceps tenodesis sutures are somewhere up here. There we go. Holding down the biceps right next to it, right in the groove. Okay, so good luck to you now. I hope that does the trick for you. Bye-bye.